Doc, you said about half of your studies offer eConsent. I mean, when you're doing those other ones, are you wishing that you had eConsent? Is it uh, your preferred?
Definitely.
Yeah.
It is definitely an easier process using eConsent versus the old.
And how did the patients feel? I mean, it seems like they would appreciate that, or I don't know. Does it depend on the patient demographic?
Exactly. I'd say, we've been inundated with technology, for the past 15 years. So most people are comfortable using their smartphones and computers. But I think the specific demographics of the patient, do they have the financial wherewithal to have a computer, have the smartphone, and do they feel comfortable with that technology? Do they have internet access? Those are some barriers. But I'd say by far most people are very, very comfortable with doing e-consent.
Yeah. Feel the same way, Robert?
I do, and I agree with Dr. Moriarty. I mean, a lot of the eligibility criteria these days require participants to have, access to a cellular phone, a Wi-Fi internet connection, things like that in terms of just standardized eligibility criteria to encompass this tech era that we're, kind of moving toward. However, I don't necessarily, think that it's appropriate for some of our elderly participants, depending on therapeutic indication. Um, they're still not computer savvy. They struggle with cell phones. Very few of them can text message. So to ask them to go into a PDF concerns me because I myself have seen time and time again very uninformed patients who are enrolled in clinical trials.
Hmm.
Fear of getting in trouble, fear of being honest because they feel that they want to go see or seek out an alternative treatment. They don't want to jeopardize their current situation or ability to obtain another treatment. That to me is not an informed patient, right? So, and suffice to say, those situations use the e-consent. This was an elderly population in this particular trial that I'm thinking of at the moment, but given good training, given good resources at the site level, given the adequate time and availability to spend with those types of patients in that population, geriatric population, you can, they can get it. They can
Yeah.
get it. You walk them through it side by side. You just have to have the time. But unfortunately, I'm sure Dr. Moriarty maybe get his opinion on this, but the sites are busy.
Right.
They're typically understaffed. They don't have enough bodies to do the work, and oftentimes CRCs are doing three, four things. They're not just seeing the patient.